Hi there, I'm Rebecca Kershaw and I'm an apprentice solicitor here at Ridley and Hall.
Hello, I'm James Urquhart-Burton. I'm a solicitor and partner at Ridley and Hall, and I specialise in NHS Continuing Healthcare funding.
So could you tell us a little bit more about Continuing Healthcare?
Sure, so Continuing Healthcare is the name given by the NHS to a package of care that is 100% fully funded by the NHS to meet your care needs. It is provided in any care setting, whether it be in your own home, a residential home, or a nursing home. And the important thing to note about it is that it is non-means tested, unlike local authority funding for social care. So if you're eligible for continuing healthcare, then the local integrated care board, or ICB, will meet the full cost of your care.
Wow, that sounds great. What's the catch? Is there a certain criteria that you have to fit in order to be eligible?
Absolutely. So the criteria is laid down in the National Framework for Continuing Healthcare. And essentially, you're eligible for continuing healthcare if you have what's called a primary health need. Whether or not you've got a primary health need is not an easy one to answer because there's no legal definition of primary health need. But the National Framework indicates that a multidisciplinary team, best practice is that it comprises a nurse assessor and a social worker who complete a decision support tool and make a recommendation on your eligibility for continuing healthcare. Whether or not you have a primary health need essentially comes down to the level of skill needed to meet your need, and the assessors are usually looking for your needs to be presenting with intensity, complexity, or unpredictability, in order to make that judgment whether the level of skill needed to meet your needs takes you into primary health need territory.
Wow, that sounds really complex. Are there any potential problems which can arise with continuing healthcare?
Yeah, so one of the main concerns with continuing healthcare assessments is inconsistency in decision making. I mentioned that primary health need test and the sort of clinical judgment that is made about whether your needs are intense, complex, or unpredictable. And whilst the National Framework talks about what those things are, it really comes down to a matter of personal opinion whether your needs meet that criteria. And so different multidisciplinary team assessors, different ICBs around the country will consequently come to different decisions on similar needs and facts. So continuing healthcare has been referred to as a postcode lottery by many a news article because it can be possible to get continuing healthcare in one part of the country for a certain set of needs, but you would be assessed as ineligible in others. There's also a real lack of information about continuing healthcare, which means that the vast majority of the public, in my experience, don't actually know what it is to even ask about it.
Yeah. So how does somebody maximise their chances of getting funding?
Well, I think the first thing to do is understand how the assessment works and what the process is. So for anybody starting out on this journey, I'd recommend as a starting point having a look at the NHS Checklist on the Department of Health website. This is a screening tool that's completed by a single assessor to determine whether or not you actually need to have a continuing healthcare assessment in the first place. Familiarise yourself with the criteria and the descriptions of the various needs in the different care domains that they look at. Secondly, have a look at the decision support tool, familiarise yourself with it. That's the document that the assessors complete when they're actually assessing eligibility. Do you think your loved one should score high or severe in the domain of cognition based on the descriptors and based on what you know about your loved one? It's worth forming those initial opinions before going to the assessment so that you're as prepared as you can be. It's also worth having a think about what evidence might be available to support the assertions you're making about your loved one's needs. And I think if there's any doubt or you're wanting to maximise your chances of getting funding, it's definitely worth speaking to someone like a solicitor in order to get an understanding of what evidence you might want to put together to make your case for eligibility, but also to make sure that the case is articulated orally in the right way at the assessment, and to actually have an understanding whether it is a case that's worth putting your time, energy and effort into fighting.
Yeah, thank you for that information. If anyone has any problems or queries, don't hesitate to contact Ridley and Hall on 0800 860 6265 or email us at info@ridleyandhall.co.uk. You can find links below the documents that James has mentioned. Thanks for watching.
Thank you, everybody.
Bye.